stars now, and the National Toxicology Program from the Department of Health and Human Services released a report recently linking high levels of fluoride with lower IQs in children. Dr. Namisha Amin, a local pediatrician, joins us this morning to talk about the report and concerns it might raise. Dr. Amin, thanks for coming in. We appreciate it.
Of course. Thanks for having me.
So first of all, could you explain what is fluoride, where is it found, and why is it there?
Yes. So fluoride is a naturally occurring element or mineral, and its most important benefit in humans is maintaining healthy teeth. It tends to prevent cavities, or at the very least slow the development of cavities in those who are very cavity prone. As I mentioned, it's a naturally occurring element, and so it can be found in drinking water. In many communities throughout the U.S., if it's not found in the drinking water, it's actually added to it because we have learned that its benefits on teeth are so great. Other sources are of course our toothpaste, and then there is a supplement by prescription for those who tend to be very cavity prone as well.
Okay, so looking now at the report, it linked levels of fluoride of 1.5 milligrams per liter, which is about twice the level recommended by health officials, with lower IQ in children. And a very small fraction of the U.S. population, about 1.9 million people, are on water systems with naturally occurring fluoride levels higher than that threshold. And my question is, does the report address the use of things like fluoride toothpaste, mouthwash, in addition to the fluoride treatments kids get at the dental office? Does it address those things as well? And what happens when those are combined with the water levels of fluoride too?
Right. There are many faults with this study, unfortunately, despite the fact that it gained a lot of traction and concerned a lot of parents. And one of the issues is that, yes, it studied this level that is very high and doesn't apply to 95% of communities within the U.S., but it also doesn't take into account how much of that water needs to be consumed, how much of that water plus what kind of toothpaste. And the list honestly goes on and on and on. And so the study itself has been faulted quite a bit, particularly by the American Dental Association, who are strong proponents of fluoride because they are the ones who are constantly taking care of our teeth. And one thing that I know, even as a pediatrician, particularly for children, is that healthy teeth actually is linked with better health overall. Even when you take away some confounding features like how much access do you have to your dentist, to your doctor, socioeconomic status, etc., we know that it is important to have a healthy teeth and a healthy mouth to then allow the rest of your body to be healthy as well.
Does the study talk about anything like how much lower of an IQ are we talking? What kind of a detriment are we talking about?
Again, it does, but the IQ tests were done in children in other countries. So again, it starts to make these results a little bit difficult to necessarily apply to all U.S. children. And the reduction in IQ was 2 to 5 points. And so whether or not that really comes into play in terms of how a child develops, how well they do in school, later in life, how it allows them to perhaps get a job or succeed in what they choose to do, I don't know that 2 to 5 points when we don't have a reference range of how much you actually have to drink to get that reduction is telling us very much of anything at this point in time.
Should parents be concerned about, you know, we've got the fluoride in the water, but then we also have the mouthwash with fluoride and the toothpaste with fluoride, and every time you go to the dentist, you get a fluoride treatment as well. Should we be concerned about all of those compounding together?
I personally don't think so. Here in Bakersfield, our water is not fluoridated. And so if you look at the water reports that we have, it's either undetectable to a maximum of 0.17 milligrams per liter. So now we're talking almost tenfold less than what was found in the study. And then on top of that, when we brush our teeth and we use mouthwash, we as adults are spitting that out. The way in which we counteract that for children is that from 18 months to 3 years, we recommend just like the size of a grain of rice of toothpaste, because we know developmentally they're not quite there yet to where they can spit it out. And we don't recommend mouthwash, obviously, in those age groups because they're just going to drink it all. And so it goes from there. But again, I think that and again, with the fluoride varnish, it's going on our teeth and then we rinse. We're not actually consuming any of those dental forms of fluoride with the exception of a supplement. Those supplements are by prescription. They are done with the regulation of your dentist and kind of weighing out those risks and benefits, particularly in those kids and adults who are very prone to cavities.
All right, which again, like you said, is a big issue. Yeah. All right, Dr. Amin, thank you for coming in. We appreciate it. Giving a little light to this study.